A very good afternoon and a warm welcome to our Facebook Live today. Today our topic will be understanding vaccination. There has been a concern over that Malaysia has purchased a COVID-19 vaccination and this has raised a lot of questions among the people. For example, what is a vaccination? How does it help? Would it be harmful to our human body? So I hope that by this end of this section, I hope everyone will understand what is a vaccination and how does it help. So before I proceed with the section, allow me to introduce myself. My name is Tan Kamen. I'm a registered nurse in our Assunta hospital, and I'll be the moderator for today. Thank you all for joining us today, and I hope you all are safe and well wherever you are during this COVID-19 pandemic. So it's a very honor today to have our Professor Ngeow Yun Fong as our speaker for today. Professor Ngeow is graduate from the King Edward School of Medicine in Singapore and trained in medical microbiology at the London School of Hygiene and Tropical Medicines. She worked as an academic staff in the University of Malaya until 2006 when she left to join the National Public Health Laboratory, Ministry of Health as a consultant bacteriologist. In 2009, she returned to the University of Malaya as a senior research fellow in the Department of Medical Microbiology, Faculty of Medicine. She is currently a senior professor in the Department of Preclinical Science, Faculty of Medicine and Health Sciences, and chairperson of the Center of Research on Communicable Diseases in University Tunku Abdul Rahman, Malaysia. So here's a little reminder to every one of you. If you have any doubts or questions during the live section, you may submit your question using the comment box below, and the question will be brought out to our speaker during the Q&A section. And don't forget to like and share our live session to your friends and family so they can join us in this live session. So now, without further ado, let us welcome our Professor Ngeow to give a live session on understanding vaccination. So, Professor, please. Wait down.
Good morning or good day. Yeah, I'd like to start by thanking Assunta Hospital first for this invitation to give this talk. And I picked this topic, understanding vaccination, because as our moderator has told you just now, we've been bombarded with lots of information about the new COVID-19 vaccines that we may be using in the near future. And so I thought it's timely that we take a revisit, what we know about vaccines and what good and what harm they can do to us. So we go on to my first slide. Yeah. This is just to remind us how we can prevent infectious diseases. Infectious diseases are caused by infecting agents, which may be bacteria, viruses, fungi, or parasites. And these are the agents that we get from other people, from our environment, and also from animals, both domestic and wild animals. So we can prevent exposure to these infecting agents by protecting ourselves by wearing masks, by observing physical distancing, keeping a safe distance between ourselves and other people around us, by disinfection of surfaces that we touch regularly. And also if we are dealing with food and waterborne diseases, for instance, we will have to practice good personal hygiene, food preparation hygiene, and keep our air and water clean, etc. So when we actually have been infected, there's still a chance for us to prevent getting the disease from the infecting agents. And the examples of this will be seen in rabies, for instance. This is an infection caused by the rabies virus, but the incubation period can be very long. It sort of can extend from months to years even. So after we've been bitten by a rabid animal and we have been exposed to the rabies virus, there's still a chance during this long incubation period for us to take a vaccine, so that although we are infected, we will not go on to get the clinical disease from the rabies virus. Another example is for healthcare workers, doctors and nurses who look after patients. If the patients are confirmed to have, let's say, meningococcal disease, meningococci are bacteria that can cause severe infections like meningitis. So if the patients are confirmed to be having a meningococcal disease, for instance, it's recommended that the doctors and nurses looking after the patient take antibiotic prophylaxis. So they take antibiotics to prevent themselves from also coming down with the meningococcal disease that they could have contracted from the patient. Another good example is tuberculosis. I think most of us know what tuberculosis is. Many of us are infected by this tuberculosis bacillus, but we do not show any signs and symptoms because most of the time the TB bacillus remain dormant in our body. And they don't cause signs and symptoms, they don't cause much damage to our body cells. So again, this latent period of infection can be very long. So we also have a chance to get rid of these dormant tuberculosis bacilli by taking medication, because the latent tuberculosis can one day become active tuberculosis under certain circumstances. So we want to prevent our latent infection from becoming an active infection that can cause us a lot of damage. So again, here is a chance for post-infection prophylaxis treatment. So that brings us to vaccination as the method of prevention of infectious diseases that most people are aware of. And in vaccination, we induce the host's own protective immune response to infecting agents. Yeah. So the story of vaccination goes back to this English gentleman, this English physician and scientist called Dr. Edward Jenner. Although I think in the 15th century, there is evidence that in the 15th century, people in China were actually practicing some kind of vaccination. But because their methods are not clearly described, the honor of being the father of immunology and vaccinology went to Dr. Edward Jenner. And the story goes that this doctor is seeing milkmaids who get infected with the cowpox virus and get these pock-like lesions on the hands. And in the 17th and 18th century, smallpox was actually a very dreaded disease. It's causing a lot of disfigurement among patients, as well as a lot of deaths. So Dr. Jenner observed that the milkmaids who get cowpox signs on the hands do not get the typical signs of smallpox, that is pox on the bodies and the face. So he thought that, well, maybe something in the cowpox is preventing the smallpox infection in these milkmaids. So he made a little experimentation. He had a young child who was about 8 years old, I think, with signs of smallpox. And he extracted material from the cowpox lesions from a milkmaid and injected into the boy with the with the smallpox, sorry. And this boy recovered. So that is the start of this modern vaccination using cowpox to prevent smallpox in patients. So the smallpox vaccine became our first modern vaccine. And it is this vaccine that went on to enable the eradication of smallpox, right, from the face of the earth. Next, please. So since then, we've had many successful vaccines and some not so successful ones, and some vaccine that's been, undergoing development for years and yet haven't sort of materialized. The successful vaccines are those that we are very familiar with, that we use in our mass vaccination for children. These are the measles, mumps, rubella vaccines, the diphtheria, tetanus, pertussis, polio vaccines, Haemophilus influenza B, the HIP vaccine, that we give to all the young infants and young children. Then hepatitis B vaccine that is given at birth to all Malaysian babies, and hepatitis A vaccines that we give to travelers and to prevent them from getting the foodborne hepatitis A infection. We also have vaccines against meningococcal and pneumococcal diseases, also again in children and young adults. Rotaviruses, a very important vaccine for children. Later on, we also had chickenpox vaccines against rabies, and the human papillomavirus given to prevent genital warts as well as cervical cancer. Right? So these are success stories for vaccine production. I have three examples for the not so good vaccines. The first one is BCG. I think most of us know what BCG vaccines do. They protect us against tuberculosis, or rather they're supposed to protect us against tuberculosis. We get BCG vaccine again at birth. We give them to children at birth. But it has been found that this BCG vaccine, which is a live attenuated strain of a cow strain of tuberculosis, bacillus, it is not so good a vaccine because although it can prevent serious infections in young children, it doesn't really give a lot of protection to older children and adults. So that means that even though you have been vaccinated with BCG, you can still get tuberculosis later on in life, particularly when your immune system is down, is weakened. Another example is a dengue vaccine. There's only been one licensed vaccine, I think, so far. And this vaccine was very briefly introduced a few years ago to Malaysians, but it was very quickly terminated because of reports of serious infections in vaccinated children in the Philippines. So it's still, although the vaccine company has modified the recommendations for vaccination to avoid those serious side effects, still in Malaysia we have not adopted this vaccine yet. The malaria vaccines are also not so satisfactory. There's again, I think only one licensed malaria vaccine so far. And this is probably because there are many different types of parasites, plasmodium parasites that cause malaria. So it's very difficult to make a vaccine to cover all these plasmodium species. So examples of vaccines are still undergoing development, although they have been under development for many decades. And these are the respiratory syncytial virus, the cytomegaloviruses that are common in children, as well as in people with weakened immunity, the CMV particularly, and of course the HIV virus. We all know what HIV is. And now the COVID-19 virus. Although we have just heard that some countries have started, giving their populations COVID-19 vaccines, but all these COVID-19 vaccines have not completed the whole series of clinical trials that vaccines are supposed to undergo before they are given to the public. So I would consider them as vaccines still under development. So let's go to the principle of vaccination. Just a reminder that in vaccination, we use an antigen, which can be the whole infecting agent or part of it. A protein may be taken from the infecting agent. We take this antigen and we give it to the host to generate a specific immune response to this infecting agent without causing disease to the host. Right? So following the vaccination, the vaccinated person develops sensitized cells that can produce specific antibodies and that can kill off the antigens. And some of these cells are then later stored as memory cells. So it is these memory cells that we want to generate when we produce when we vaccinate, so that on exposure to natural infection to the same pathogen used in the vaccine, these memory cells will be quickly stimulated to produce antibodies and cytotoxic lymphocytes that can recognize the infecting agent and destroy it very quickly. So the aim of vaccination is to induce a long-lived immune memory. Next, please. Okay, so there are many different types of vaccines. The oldest generation of vaccines are the living attenuated vaccines, the inactivated vaccines, and the toxoids. The living attenuated vaccines are actually infecting agents. They are alive, but they have been weakened by chemical modification, and so they cannot cause disease, but they can still stimulate a specific immune response to the antigen in the living pathogen. And so because the vaccine is a living pathogen, it stays in the body for a long time, it can multiply in the body, so it provides a very long immunity. As long as the vaccine is still there in the body, there will be the antigen will be able to stimulate continuous immunity. But the downside to these living attenuated vaccines is because the vaccine is a living bacterium or living virus, it can still grow and it can regain its virulence. It's been weakened, but if it's allowed to, let's say, go to be passed on to people who have not been vaccinated, they can become stronger and stronger, and they can regain the ability to cause disease. And they can also cause outbreaks in the community. This is the story of the previous polio vaccine that we used to give to our children. These polio vaccines are living attenuated vaccines. They're live but weakened polio viruses. But these viruses can be passed out in the stool of the vaccinated people. So then when they get into non-vaccinated individuals and they're passed from one non-vaccinated individual to another one, they can regain the virulence, they can regain the ability to cause poliomyelitis. And these vaccines have been associated with community outbreaks of polio. So it's a vaccine strain causing community outbreak. That is why now we have stopped using the living attenuated vaccines. We are now giving inactivated vaccines, which is the second category of vaccines here. I've shown here in my slide. So the inactivated vaccines are actually dead pathogens. We have killed them by chemicals or heat. So they cannot replicate, but they can still generate a specific immune response. So because they're dead proteins, so our immune cells in our body will get rid of them, like macrophages, for instance, will engulf them and get rid of them. So over time, these vaccines will be present in less and less amounts, and so the immunity stimulated will also become weaker and weaker. And generally, these inactivated vaccines will give a shorter immunity than the live attenuated vaccines. Now, toxoids are modified toxins. Some bacteria, they produce toxins, which are proteins that can damage our host tissue cells. So again, we can take these toxins, chemically modify them so that they can no longer be toxic to our body cells, but they can still, again, stimulate an immune response. So these are the toxoid vaccines. Some other types of vaccines are generated synthetically. They are recombinant vaccines, for instance. They can be subunit vaccines or vector vaccines. These recombinant vaccines are parts of infecting agents that are put into either a bacterial cell or a human animal cell, so that the cells can produce large amounts of these antigens. So these antigens produced by the cells are then purified and put into vaccines to be injected into human hosts. So these, again, they are non-living substances. So the immunity that's um, generated will not be as long as that generated by live attenuated vaccines. But because they are non-living, they are suitable for people with weakened immune systems, like the immunocompromised population. Vector vaccines, another kind of vaccine that's delivered to the host with the help of a carrier. The carrier can be a yeast, the carrier can be another very common but harmless virus. So we use the carrier to introduce the specific infecting, the antigens from the infecting agent to our own immune system, so that specific antibodies and sensitized cells are generated to these infecting agents. But the disadvantage is because the carrier is also a living microbe, their genomes can get, it's possible that their genomes can get integrated into our host genomes, the genomes from our own cells, to cause, side effects that we can't tell, what kind of changes can be done to our own host genome. And also because they are common microbes, so it's possible that the population would have been exposed to them before the vaccinations, and also these previous exposures could stimulate pre-existing immunity against the vector, and this will affect the uptake of the vaccine, and also will shorten their or weaken their immunogenicity. So the last class of vaccines will be the nucleic acid vaccines. These are modern vaccines, the DNA and RNA vaccines. These are genetically engineered and inserted into the host cells. When the nucleic acids get into the host cells, they are changed to antigens, which they're translated into the antigens of the specific infecting agents that we want to protect against. So the host cells then becomes the factory for the production of the pathogen antigens, right? So it's like we introduce the nucleic acids from the infecting agent into our body and make our body cells produce the specific antigens to stimulate an immune response against the infecting agents. So that's the principle of these nucleic acid vaccines. These vaccines generally would provide strong and lasting immunity, that is, as shown in animal experimentation, because they haven't been around long enough to know what they do to humans. And they're also easy to design because we don't need to grow up a lot of bacteria or viruses to extract antigens from them to put inside our vaccines. We can just use molecular studies with genomic studies or sequencing technology to sequence the whole genomes of the infecting bacteria or virus. And then once we know the genome sequence, we can design the vaccines. So they're easy to design, they're easy to produce, they're easy to test, these vaccines, right? But and also they because they're not live things, so they cannot replicate, they cannot mutate, as in the case of live attenuated vaccines. So they're quite safe to give to people with weakened immunity. The main concerns are that this is a new technology. Most of these vaccines have been just designed, made in the last decade or so, and in the last few decades. And so there are many aspects of the immune responses that they stimulate that we don't fully understand. So we really don't know what to expect from these DNA and RNA virus vaccines. And most of them have not been licensed for use in humans yet. The DNA vaccines have been licensed for use in animals, and RNA vaccines are not licensed yet, although again recently we've been told that some countries have been given emergency use approval for these RNA vaccines, which have not undergone the rigorous investigations that they should undergo before they are licensed for use. Okay. So who to vaccinate? Everybody wants to know who needs vaccines. Obviously, it's those people who are susceptible to the serious disease from infecting agents. And these will be mostly people at the extremes of age, the very young, the elderly, and people with weakened immune systems, the immunocompromised populations. And also those who can't afford to get sick, like military, the soldiers, we need them to protect our country so they cannot get sick. Healthcare workers, we need them to take care of our patients. Who's going to look after the patients if they're all sick? Food handlers are those, we don't want to catch the infecting agents from food handlers because we buy food and we consume the food they produce. And international travelers, they don't want to be sick and spoil the holiday. Yeah, they want to be vaccinated to prevent diseases that they may get from the countries that they're going to visit. Okay, so how do we choose vaccines? Most of the time, we leave this to the doctors. The doctors recommend the vaccines for us, right? But the choice of vaccines will depend on the efficacy of the vaccine. What kind of protection can we expect from the vaccine? Is it going to be like 100% protection, or sometimes for some vaccines, the degree of protection may be as low as less than 50%. The duration of protection, how long will we be protected after one course of vaccination? How many doses do we need to take? If the protection is not lifelong, we may need to have boosters, yeah, to maintain our immunity. And the route of administration, whether most of the time is injection, but nowadays we also have skin patches with tiny little needles that puncture our skin and introduce the vaccine inside. We can also have vaccines that can be given by inhalation. You can breathe in the vaccines and they can be sprayed into your mouth and eyes as well. The eye is actually a very good mucous membrane to absorb the vaccines. And also the vaccines can be put in water. For instance, if you want to vaccinate your fish in the tank, or fish in the fish producing ponds, this is the easy way to put the vaccine in water and let them vaccinate the fish, right? So different routes of administration will also affect your choice of vaccine. Next, please. And of course, side effects. We will not choose any vaccines that are going to give serious side effects, right? For the people who buy and distribute and store vaccines, of course, the method of distribution and storage is important. Some vaccines require to be stored, to be kept in freezing temperatures all the time, and that's going to be very difficult to bring them in and distribute them to clinics and hospitals. And for consumers, it's a cost. We don't want the vaccines to be unaffordable. Okay, so the process of vaccine development, very tedious. A vaccine used to take about 10 to 15 years to be developed, to be ready for use in humans, because it goes through all these stages. In the exploratory stage, we want to see which antigen is going to be suitable, which is going to be safe, and then after you've found a suitable candidate for the vaccine, you've got to do laboratory studies using animals. Let them get all the side effects first before the vaccines are used on humans. Of course, the animal rights activists will not like this. And then when the preclinical experiments show that the vaccine is safe enough to be used in humans, then we go through the clinical trials. And if the vaccine passes all the clinical trial requirements, then they get manufactured. Yeah. Okay, so the clinical trials goes through many different phases, usually 4 phases. In the first phase, small groups of people, usually under 100 human beings, they receive the trial vaccine to look to assess whether the vaccine is going to produce the required immunogenicity and also whether there are any side effects and so on. Then if they pass phase 1, they go on to phase 2, where the vaccine is given to larger number of people, usually in the hundreds. Again, to look for immunogenicity and side effects, and also to see whether the doses are appropriate, then the dosage is appropriate, and also the dosing interval is appropriate. And also, if they pass phase 2, then they go on to phase 3. In phase 3, the vaccine is more or less like the final version that's going to be given to people. So they will be given to thousands of people, and they will be tested again for efficacy and safety. And if phase 3 is passed, then the vaccine can be licensed for use, and then phase 4 will be like post-licensing survey of what happens to people who are vaccinated. Anything that unexpected from the vaccination will be recorded. So now we come to the COVID-19 vaccines. We talked about the general information on vaccines. Now, what our interest at this moment is, what do we know about the COVID-19 vaccines? Well, several countries have made candidate vaccines. None have reached the licensing state yet, although some, like I said, have been given approval for emergency use. The vaccines from the US that Malaysia is thinking of bringing in, they are RNA vaccines. These are messenger RNAs from the COVID-19 virus. These vaccines have undergone phase 3 trials in a few countries, and the vaccine manufacturers claim about 90 to 99% efficacy. So it looks like they're going to be, very immunogenic. They can stimulate the specific immune response to the COVID-19 virus. But the main disadvantage is that these being messenger RNAs that can be degraded easily in warm temperatures, they need to be kept frozen and deep frozen at about -70 to -80 degrees centigrade all the time to prevent them from being degraded. So it's going to give a lot of trouble to people who are going to distribute and store these vaccines before they're given to the population. Yeah, and also some side effects have been reported, chills, fever, and pain in the limbs, in the muscles. And also mostly because these are new vaccines, we don't know what are the long-term side effects. Yeah, we don't know how this vaccine is actually going to affect us. Although preliminary investigations in the exploratory laboratory animals investigations and the early phase trials show that there are no sort of serious side effects, but still, many people are worried. This is a new vaccine. What don't we know about it? So the other COVID-19 vaccines are candidates from China. China has produced, I think, at least 5 candidates. They have surface protein vector vaccines, as well as whole inactivated virus vaccines. The advantage of these vaccines is because they are not live viruses, and they also are not nucleic acids that can get degraded very easily. So they only require ordinary storage in ordinary refrigerators. Yeah? They don't need deep freezers for storage. So and also some side effects have been reported. But I think one company from China has said they have actually given the vaccines to more than 1 million subjects in different countries, and they don't have any reported side effects. Well, this is the news from the company. And also, like the US vaccine, the Chinese vaccines have been given emergency use approval, principally in China. And the British has this AstraZeneca vaccine, and the Russians have produced their own Sputnik vaccines. Okay, but the main vaccines that we are looking at nowadays is the vaccines from US, the Pfizer vaccine, for instance, and candidate vaccines from China. So to sum up, we have some general concerns about the COVID-19 vaccines. Because the vaccines have been developed so quickly, like we said, the traditional vaccines need 12, 15 years of development. But these messenger RNA vaccines, for instance, from the US, it took them about 63 days. That's about 2 months only to go from the exploratory stage to phase 1 trials. So, because these are nucleic acid vaccines, we've said they're easy to produce, they're easy to test, and so on. So the vaccines have been developed, the vaccine has been developed really quickly. But because they've been developed so quickly and they are so new, there's still many unknowns, and we don't know how effective they are, despite the companies claim that they provide 95 to 99% of it. Immunogenicity is this going to hold true? How safe they are? They haven't been tested long enough to look for all kinds of side effects. How many doses are required? Do we need lots of boosters to maintain immunity? Are there any serious side effects like antibody-dependent enhancement that is associated with the dengue vaccine that causes more serious infection in vaccinated children compared to those who are not vaccinated? And also, what about long-term harm? We really don't know because this vaccine is so new. Is this vaccine now safe enough to be given to large populations of healthy people? When doctors treat with medications, we are treating patients who have disease. But when we vaccinate people, the recipients, the vaccine recipients are actually healthy people. So the safety margin here is much larger than giving drugs for medication, right? We don't want, or we should try as far as possible not to give harm to healthy people who receive vaccines. So the last slide, after this, maybe you'll be more capable to answer these questions for yourself. Are the COVID-19 vaccines ready for use? The candidate vaccines that are being recommended. And are we ready for vaccination against COVID? This is for everyone to decide. Would you like to be vaccinated against COVID-19 with the vaccines that are made available for emergency use? Okay, and so I will leave that for your questions, and thank you very much for listening in.
Thank you everyone for your attention. So if anyone still has any question, you may still submit your question into the comment box below, and the question will be brought up to the speaker, Professor Yao, in a short while. So to those who's still staying with us today, thank you once again for joining with us. So kindly spare us a few minutes time for Professor to prepare for the Q&A section. And meanwhile, you may still keep the question coming in to keep the live section active. Okay.
Let's see.
Okay. So now we shall proceed with the Q&A section. So the first question is, what are the major difference between the vaccines, Professor?
Yes, actually, this was covered in some of my slides. Yeah, different types of vaccines are made in different ways. So they will stimulate immune response, different kinds of immune response. Some will be long-lasting, some will be very protective, others will be less protective and shorter lasting effects. All this depends on what we put into the vaccines. So if they're living attenuated vaccines, for instance, they are alive, they can mutate, they can regain their virulence, and they can actually cause infection in some people. But the dead vaccines, for instance, they will not be able to cause infections, but they will not give such a long duration of protection because they are got rid of by the body's own immune cells eventually. So the differences that we are concerned about is the percentage of protection, the amount of protection we get from each vaccine. Is it going to be 100% protection, or is it going to be very poor, maybe 50-60% protection only? And also the duration of protection. Is it going to be a lifelong immunity that we're getting from the vaccine? Or does the protection only last maybe 6 months? Some vaccines actually give you only a few months of protection, or just a few years. So if, for the vaccines that give you short-term protection, we will need to get booster doses, repeat vaccine courses of vaccination to maintain the immunity. And yeah, okay.
Thank you for
and the side effects as well. Yeah, different vaccines are associated with different side effects of different severity. Yeah. So we hope that most of the vaccines will not give severe side effects.
Yes. So thank you, Professor. So the next question is, how long to wait for vaccination once one has a fever or infection?
How long to wait for vaccination? If you think you have the disease already, yeah. These are examples I gave for the post exposure prophylaxis. So it depends on the incubation period, but this one is not incubation because this patient has already developed a fever, right? So you must get a diagnosis to see what's causing your fever before you get a vaccine. Because if the infecting agent is already in your body and is already causing signs and symptoms, it may be a little late to go for vaccination. Except, for infections like rabies, like we said, you may have a few sort of initial signs and symptoms, but the virus has not developed yet in the body to cause serious damage. So you still have a chance to take a vaccine to prevent the disease, but you're already infected.
Mm-hmm.
So it all depends on the infection that you're trying to prevent.
Okay. I hope this can answer. So the next question is, how do vaccine works to protect us?
Oh, vaccines, like we said, they can be whole living organisms, like a whole virus or a whole bacterium, or parts of the infecting agent, a little protein or a little bit of sugar from the virus or the bacteria.
Mm-hmm.
And we inject these antigens, we call them, protein antigens or carbohydrate antigens. Most of the time, they're protein antigens. We inject them into our body. So our body's immune cells will capture them and will process them. And some of these immune cells will be able to produce antibodies to neutralize the infecting agents. And some of these cells will be able to kill the infecting agents that are captured by our immune cells. Right? So some of these immune cells are generated on exposure to the vaccine, are kept as memory cells. So after vaccination, let's say if the person gets exposed to the same infecting agent, let's say the vaccine is against a particular virus, COVID-19, for instance. So if after vaccination, if this person is then exposed to infection by the same virus, COVID-19, we would expect our memory cells that are stored after vaccination to be able to come out very quickly to destroy the virus before the virus can cause damage to us. Yeah. So we are actually making a store of these memory cells that are generated by the vaccine. So the vaccine is like the agent, the infecting agent.
Yes.
It comes in. We produce an immune response to the vaccine. But this immune response, the cells involved in this immune response is stored in the body after the vaccine effect is gone. But these memory cells can still respond to a future attack by the same infecting agent.
I see.
Yeah. So after vaccination, you will get, let's say you're vaccinated against measles. But after that, you may get a measles infection. But when the measles infection occurs, your body is already primed. It already has this store of memory cells. So as soon as the measles virus comes into your body, the memory cells will generate, they will be activated, they generate either antibodies or sensitized cells to kill off this measles virus. So that's how your body is protected from a future measles virus attack.
I see. This is very interesting.
Did I explain it clearly?
Yeah. So the next question is, for those of us that have had the COVID, is it really necessary?
For those of us who have had COVID, okay, if you've already had COVID, is it really necessary to get the COVID vaccination? Not really, because if you've got the COVID and you've recovered from COVID-19 infection, your body would have manufactured its own immune cells to protect you against future COVID infections. But again, like I said, this virus is a recently discovered virus. We don't know very much about the duration of immunity, the strength of the immune response from the infected person, as well as the duration of protection from our own natural response. Right?
Okay.
Yeah.
So,
but generally speaking, from the principles of vaccination, if you have recovered from an infection, you will not need to have the vaccine.
I see. All right. So
unless this, like I said, the duration of immunity is very short, then you may perhaps benefit from vaccine sometime down the road.
Yes. Okay. So in the interest of time that we're unable to bring up any more questions, so thank you for keeping the questions coming in. I hope this will help everyone, and we will answer the rest of the question by replying to your comment. So thank you once again, Professor, for giving us an in-depth talk into vaccination. I have already learned a lot from your talk. So to those who are still want to ask any question, we will still reply. We will answer your question by replying to your comment. And thank you to all of you who joined us throughout this live section. I hope you all is benefit from as much as I do from this talk. And stay safe, and please join us in our next live session on women and joint pain by our consultant physician and rheumatologist, Dr. Shamala. And bye-bye. Thank you.